You're watching the news at 10 live on Channels Television Lagos. A reminder of our top stories. Nigeria records a total 65 confirmed cases of coronavirus as National Center for Disease Control confirms 14 new cases. Minister of Health confirms that an unnamed aide to President Muhammadu Buhari has tested positive to the coronavirus and is being treated at one of the facilities. The federal government considers tough measures to limit spread of coronavirus disease, including a ban on interstate travels. And global coronavirus cases surpasses 500,000. Plus business and sports, and news from the FCT Abuja, and later international news from our London studios. Now, our website, channelstv.com, has more information on our top stories and others. Subscribe and watch Channels Television's live stream on YouTube and other social media platforms using your mobile device browser, or download the Channels TV app for Android and iOS devices from their respective stores. You can also watch us via your smart TV platforms on Apple TV, Android TV, Fire TV, and of course Roku. So looking at the measures taken by different states in Nigeria, all land borders leading in and out of Delta State, effective Sunday, March 29th, are to be closed. This is part of additional restrictions announced by Governor Fayo Kowa in an address to the people on the coronavirus pandemic. Although Delta State has no confirmed case, the government insists that measures are necessary to avert any outbreak or contain its spread if it occurs. Businesses, including malls, supermarkets, shops, and markets, will be shut from Wednesday, April 1st, with residents asked to stay home.
Asaba Airport is to close to traffic effective Friday, March 27th, 2020 by 6 p.m. All land borders into and out of Delta are to be shut effective 6 a.m. Sunday, March 29, 2020. All business malls, supermarkets, markets, and shops are to close from Wednesday, April 1, 2020. All residents in the state are to stay at home from Wednesday, April 1, 2020. Food sellers are to conduct their businesses within the precinct of their homes and are required to strictly adhere to the social distancing rules. Deltans are advised that there will be increased security presence on the streets and land borders to ensure strict compliance with these directives.
More governors have been revealing the status of their coronavirus tests, and today we have the governors of Bayelsa and Ondo states confirming that they have tested negative to COVID-19. Bayelsa State Governor Duoye Dire's status was announced in a statement from his spokesperson, confirming that the test result was obtained today from the Nigeria Center for Disease Control accredited laboratory at the Irwa Specialist Teaching Hospital in Edo State. He says the results show that the governor had no evidence of COVID-19 infection. Ondo State Governor Rotimi Akeredolu's test result was also announced in a statement from the Commissioner for Information and Orientation, Mr. Donald Ojogo. He says the governor willingly offered to be tested on Wednesday morning after one of his earlier contacts had been confirmed positive. There may be some light at the end of the tunnel for some of the patients undergoing treatment for the virus in Lagos is there to be discharged any time from now. And that's according to the State Commissioner for Health, Professor Akin Abayomi. The commissioner, in an interview with the Lagos-based radio station, says 6 patients who are undergoing treatment at the Infectious Disease Hospital in Lagos have fully recovered and will soon be free to go home. A social media message attributed to the Special Assistant to the Lagos State Governor on Health, Dr. Tunde Ajayi, and a presidential aide, Bashir Ahmed, also confirmed the story. Meanwhile, the Lagos State House of Assembly has passed into law an emergency bill to help the state combat the coronavirus pandemic. Sponsored by the Speaker, Mr. Mudashiru Obasa, the Emergency Coronavirus Pandemic Bill 2020 affords the state governor Mr. Babajide Sanwo-Olu the legislative latitude to spend an initial sum of 20 billion naira to effectively contain the virus and enforce compliance by Lagosians. The law also empowers the governor to declare a state of emergency of up to 3 months if the situation so demands, make recourse to the Assembly before any regulation on the pandemic, and provides a window for the establishment of Coronavirus Trust Fund. In addition, the law also stipulates a fine of 100,000 naira for defaulters, 1 month imprisonment in the Correctional Center for 3 months community service. The World Health Organization is optimistic the world can overcome the COVID-19 pandemic just like previous pandemics. WHO's Director General, Dr. Tedros Ghebreyesus, in a broadcast highlights some basic steps that every country must take to fight the virus. And the summary of his message is that the world cannot afford to waste this opportunity.
You have created a second window of opportunity. The question is, how will you use it? There are 6 key actions that we recommend. First, expand, train, and deploy your healthcare and public health workforce. And second, implement a system to find every suspected case at community level. Third, ramp up production capacity and availability of testing. Fourth, identify, adapt, and equip facilities you will use to treat and isolate patients. Fifth, develop a clear plan and process to quarantine contacts. And finally, number 6, refocus the whole of government on suppressing and controlling COVID-19.
We continue the conversation on COVID-19. Tonight we have Dr. Johan Akase, an infectious disease consultant with the Lagos State University Teaching Hospital. Luth, thank you for being here tonight, and thank you to your colleagues too for all that you do. Can you give us your assessment of, the country's response to the coronavirus pandemic so far?
Yeah, thank you for having me. Well, the country's response has to be interpreted in the context of the worldwide response as a whole. No country, it seems, has looked prepared for this. It sort of took everybody by storm. So under the circumstances, I would say the response, there's a lot of improvement, but under the circumstances, we're doing the best we can. It's clear what the COVID-19 outbreak has shown is a true test of every country's previously existing health systems and capacity. Sure. So the response is in light of what has been before. So you can see it's fair.
Yeah, and it seems that everyone is applying what they know. There's no one straight solution, to fighting this. Everyone is doing everything that they can, try different solutions. So do you agree with the World Health Organization that we can fight this? The world needs to put in necessary actions taken to fight the COVID-19 pandemic?
Yeah, I agree with that, and it's important. Like WHO Secretary I just said right now, this is another window of opportunity. Why is this another window is because, to a degree, when this outbreak, when it was not yet declared a pandemic, there was some confidence in some people, countries that, this will soon blow away, it's all right. So I think some people didn't prepare as much as they should. And one thing we've learned with this virus is that you have to be ahead of the virus. If you wait for the virus to show you a face before you react, you're probably going to be behind the response.
Yeah, the best time to prepare for war is during the time of peace.
That's right.
So now that, all systems are down or seemingly down and production cannot take place and so on, isn't it a bit difficult to say now is the time to reassess our health systems and, to put in measures, for, God forbid, the next pandemic?
Yes. Well, for countries like Nigeria, where everybody knows that we've been functioning below capacity, it's easier for us to ramp up both effort and even redeployment of resources, like you rightly said. There are countries that were functioning at near full capacity, like Italy. There was little expansion that could be done. But for us, it's clear that if we can mobilize, strategize better, we could definitely have a greater output than what was before what we're having now. So there's definitely, for us, is really an opportunity to strengthen our health systems, which we can and which we should, and also to mobilize resources and get our priorities right. And that is why I think the Lagos State have empowered the governor to mobilize resources from probably other and focus it to where it really needs.
You talk about strategies, and I know that the Lagos State government has been doing a lot on this when it comes to strategies. What more can they do in addition to what they're doing already?
So I know. So some of the things I'm aware they're doing is to open up more centers, recruit more staff, and it is so integral that while the current capacity or management of the patients in the infectious hospital is going on rather well, it's important for us to expand capacity, prepare more staff, more capacity for people that are going to treat patients, more treatment centers. Yes, we have to. Okay. Like I said, we have to be ahead of the virus. We're seeing 65 patients now. We don't know what's going to be next week. We hope it's less than that. But we have to be ahead of the virus and prepare, and which I'm aware is going on. More centers are being opened. I'm sure you heard some. And more staff are being trained to take, if there's a surge, to handle that when it comes up.
Well, we have to give it our best shot at this time. I guess we can't miss. Thank you again, Dr. Johan Akase, for being here on the News at 10.
My pleasure.
And when the News at 10 returns, Bureau de Change operators to go on a 2-week market holiday following ongoing challenges faced in local and global economies. Please join us again.